Good morning. Welcome back to the Public Health and Minority Health Disparities Subcommittee. It is February the 22nd. We have one amendment to consider today, which was it is in House Bill 576 and was inadvertently struck during the amendment process. It is a data sharing provision between the care coordination team and the court. And before we consider it, I just wanted to say that we are less than a month until crossover, so things are going to start moving quickly. Thus, our third subcommittee meeting this week on this bill. Yesterday, I did make a judgment call that we were ready to take a vote on the bill we were considering for several reasons. And I want to remind everyone watching of the process. Because I am a process person, but I know that sometimes as things start to move, it can be difficult to sort of follow how things are going. So the bill hearings are the opportunity for the public to make their will known on any legislation. And the subcommittee is for the members to work through any questions or concerns they have with the legislation. Our committee is extremely collaborative. We do the best to the best of our ability. We try to find consensus, and we invite stakeholders with expertise and an interest in the legislation to subcommittee to help inform us, to help answer questions, and because you make our work better. But we also have discretion in who we recognize. So I don't want anyone to feel disrespected or unheard if you aren't recognized in subcommittee. I also want to say a lot of work happens before these bills make it to the hearing. And assisted outpatient treatment has been before this body for over 2 decades. The bill before us is the result of hours of meetings with multiple stakeholders, including the Office of the Public Defender, the Maryland Judiciary, the Mental Health Association of Maryland, Maryland NAMI, On Our Own Maryland, and others, as well as multiple members of this committee over the course of a year to bring us to as close to consensus I think we will likely ever come. Now, everyone was invited to come to the table, and this language was considered and agreed upon to make a bill which really seeks to focus this program to the people who will most benefit from it. As you have heard multiple times from our chair, in this committee, our word is our bond, and we don't play games, especially when we consider legislation which has real-world consequences on people's lives. Even with all that, yesterday, some of our subcommittee members were concerned that there were stakeholders who went unrecognized due to the time constraints, because we are that committed to transparency and inclusion. So I felt it necessary to put on the record the process which has brought us to this vote. I did confirm that NAMI Maryland supports the bill as amended. I spoke with the Department of Health about our shared commitment to ensure anyone utilizing AOT have their somatic needs met, that we will carefully consider the processes, the nexus between emergency evaluation and assisted outpatient treatment. Those were the outstanding concerns that were that went unrecognized yesterday. And with that said, I would like to vote on the amendment. The amendment is on page 16 of the reprint. It's lines 5 through 8 that were struck and reads, if the care coordination team has knowledge of a petition for emergency evaluation that was filed for the respondent, a care coordination team member shall notify the court in writing of the reasons for and findings of the evaluation. Ms. Hopwood, did I miss anything? Aaron? Oh. All right. I think I'm going to take it that I didn't miss anything. And with that, can I have a motion on the amendment?
Thank you, Madam Chair. Move the amendment.
Second.
All right. It's been moved and seconded. Any questions from the members? Any questions, comments? I do see I have a hand from Judge Morrissey.
Thank you, Chair, and I appreciate the opportunity to talk, and I'll be very brief. And thank you for all your consideration and hard work on this bill. I'm excited about it. I just need the committee to know that and thank you, Judge our Chair Bagnall for responding to me via text or email last night. I appreciate it. The way it currently is with the deletion of the A section right before the B, and then in addition to the court no longer being able to use its finding of contempt and involuntary omission, means that there's no enforcement mechanism on this bill, that a person could go through the entire hearing, and remember, they will be represented by counsel in all likelihood, and the court can make a finding and the respondent can simply walk out of the courtroom and not do it. And there's no enforcement power at all in this bill for the court to remain involved. And we will have spent a lot of time and a lot of money getting to that point. And I don't think that Section A causes any due process concerns. It's the next logical step would be, if they don't comply with the AOT, then an emergency evaluation would be filed with the court. And all A does is allow the court to consider the AOT. In my opinion, it would provide continuity of care for the defendant, that we would be able to take the findings of the prior hearing into account in determining what's in the best interest of that individual. And it is therapeutic minded when we're sitting on this. And I could tell you stories about how many times I've done EEs and had to address adult parents of children that, that are adults that say, do I have to get arrested before you can help me? So we're very much looking forward to this bill. I hope that there can be a few tweaks that give something that the court can do if someone's non-compliant with this. And I think A would very much help that situation. Thank you.
Thank you, Judge Morrissey, and I greatly appreciate your comments. As you know, and as I communicated, that was carefully considered with the work group, and I think there was a great concern and a reasonable concern of creating a separate standard for emergency evaluation, which is why it was struck. And we know that we're going to be through, an evaluation and a reevaluation process with this program. So I very respectfully, I appreciate your comments, but we are going to resist amending that language back into the bill.
Thank you for hearing me, Delegate. And thank the committee. Thank you very much for just hearing me. I appreciate all the opportunity. Thank you.
Absolutely. Thank you so much for being here. And Delegate Hill, you had your hand up.
Yes, thank you. I don't know if this is a process question, whatever, the amendment that was sent around last night from MOPD, is that also going to be considered? Because that's what we discussed, is not the amendment that I read in the email about today's meeting that came out at 5:10 p.m.
We are not considering those amendments. The amendment that we are considering is actually in the reprint of House Bill 576. It was just inadvertently struck.
Okay, and
So
the amendment that was offered, we're not going to consider at all after this one?
The amendments were already considered as part of the work group. So no, we are not considering those amendments. Thank you. Are there any further questions from the members? All right, we have a motion and a second. All in favor of the amendment, say aye. Any opposed to the amendment? Go ahead and raise your hand in the chat. Thank you very much. The amendment passes unanimously. With that, we have no further business. I'm going to turn to Ms. Hopwood again. Are you able to hear us now?
Yes.
Okay,
sorry.
perfect. No problem. I know you were having technical difficulties.
Definitely.
That actually concludes our business on this bill today.
We passed the amendment, but not the bill?
We already passed the bill. This is just this. We passed the bill yesterday. We didn't have to reconsider it to add the amendment. Okay. This was just a technical fix to the bill. The bill as passed. I am going to go ahead and conclude our meeting. Thank you very much for all of your work. Thank you to everyone who has come to the table and helped us. Oh, I do have some hands from the members. Delegate Hill and then Delegate Alston.
Yeah, I just wanted to move the MOPD amendment to remove the nurse practitioners. You know, if there'll be a second, or there may not be a second, but I feel the need to move it. Thank you.
I do not hear a second. Thank you very much, Delegate Hill. Delegate Alston?
Thank you. I was just going to ask if Judge Morrissey could reach out. I don't have a number for him, but I wanted to discuss something with him offline.
Thank you very much. Delegate Hutchison?
Thank you, Madam Chair. So as you know, yesterday I did vote against the bill based upon feedback I was getting from my smaller counties. I had talked to the Midshore Behavioral. This morning I was able to talk to the Lower Shore. They equally have similar concerns, around funding, truly the number of potential cases that they may have, and then more importantly was how care coordination would be done. So if anybody's out there that would like to reach out to me to maybe help me walk through this, they're actually presenting it to the Eastern Shore delegation on our delegation meeting tomorrow. But I'll still go on record that I love the bill, I love the concept, but I'm really concerned about the burden it will place on our smaller counties around the state.
And I think Marie Grant from the department is here and maybe has some updated information for you, Delegate Hutchinson.
Yeah, I just wanted to say, Delegate Hutchinson, I'm happy to connect with you after this meeting. And we would be happy to talk to Midshore and Lower Shore and talk through some of those concerns. And we're putting together a pretty full picture. I just want to say that the $3 million in the budget is not the only funding that's going to be available for this program, and just would love the opportunity to connect with you and whoever makes sense to talk through.
Thank you.
Seeing no further questions from the members, we're going to go ahead and conclude this subcommittee. Do I have a motion to adjourn?
Motion to adjourn.
Do I have a second?
Second.
Thank you so much. It's been moved and seconded. We are adjourned. I will see you all on the floor.